They were representing Myna Foundation, and we are an all-women organization working for women to help them realize their potential to be financially independent and take charge of their own health. We operate under three verticals, that is health, employer, and research. With health, we want to reach 2 million women by 2025 and improve their access to health products and services. With employee, we want to generate employment among 1 lakh women and improve their employability skills. And research helps us to understand impact that is generated through our programs running under Health and Employee, and also helps us to test new programs and also modify them based on the needs of our beneficiaries. We started in 2025. Sorry for that. We started in 2025 with 5 women working under our fat production unit. That was our very first initiative where we employed local women, trained them as well. And we started with our door-to-door outreach, creating conversation around menstrual health and the stigma as well. And we were able to reach out to about 1 million women. And back then, our flagship program, Sponsorable and Teach Menses India, offered health awareness sessions on menstrual health, on gender roles to both men and women, to initiate conversation at the household level itself, and also to create role models within the community, whoever undergoes our programs, to help others also to realize their own potential and also to feel empowered and inspired to come to us and enroll in our programs. Few of our other health initiatives will be explained later on that Dr. Shraddha will take up. And sorry for that. Just looking back quickly at our milestones, where we started with just 5 women in Govandi slums. And in between, from Govandi slums to the royal wedding, we have been offering health products and services for menstrual health. And now we're scaling our programs to also offer services on sexual and reproductive health. And we're just getting started. Our mission is to increase women's agency and decision-making power at the household level to make them more confident and independent and healthy. And with this, we are always looking for volunteers. We're also always looking for good talent who can help us through this journey as well. So you can find more details on our website and on our social media pages as well.
I'm sorry, I didn't realize I'm on mute. Okay, so before we start with any of our program, we first, we conduct a very in-depth research about the program. We have needs assessment going on. This needs assessment help us to differentiate between the needs and the wants of the community, and then we cater to the actual needs of the community. We develop the program accordingly, and it's all impact-oriented programs, and we have continuous monitoring and evaluation going on to all of our programs, and we have continuous modifications according to the evaluation reports. Anjali, next. So we have, our programs are basically A, B, C, D of access. So A stands for app, ATM, B stands for bus, C is center, and D is the doorstep. So our Myna Center is the place where it's a common platform for all the girls and the community women to come in, to share their problems, to feel free and talk about anything that they want. This is a common touch point for them. We have a mobile health clinic, which goes into the community. We have a female doctor inside this, and we also give medicines related to sexual and reproductive health free of cost. So this is the female doctor specifically. We have, we want her to be here on this because we received feedback from the community that they are not very comfortable talking about their sexual and reproductive health to the male doctors. And hence we started this clinic. We also have our health ATM, which has products like sanitary napkins, disposable bags, few of the prescribed medicines. They can also have, they have contraceptives. So this is all about access. And similarly, there is access to knowledge as well through our Myna digital platform, which has our Myna app and IVRS system. So our app and IVRS both have a digital curriculum where we have very very unique content about aspiration building, mental health, physical health, and it's accessible to all. This is about our health vertical. We have a similar Myna employee vertical where we also have our own PAT reduction unit at the center. The PAT reduction unit has, we have women from the same slum community where we are based, and they are employed here. They help in pad making process. They also go door to door and sell these pads. These women make more impact in the community because the community women and girls immediately relate to them as they belong to the same community. And our community and our PAT reduction unit also knows what are the exact problems that they face, and cater to that accordingly. We also have a Myna Dost program. Dost means a friend in Hindi. It's an earn and learn program where mostly dropout girls can come join in at Myna. They can learn quite a few stuffs like, communications. They can learn about, how to use laptop, how to, basic computer courses that they usually have to pay for. Here they come, they learn, and they get paid for it, kind of thing. We also have our Rani app. Rani means queen in Hindi. So here women can, can work on the app and earn as well, like, from her own home and in her own flexible timings. So that's how we intervene in terms of empowering of women in physical health as well as her, financial independence. So all our programs, for all our programs, we use this model. We enable them to access health products and services through our ATMs, mobile clinics. We improve the infrastructure for them. Through adoption, during adoptions, we have intense conversations with them through our health education sessions. And sustainability is more about, like, continuous engagement through our mobile app, IVRS, and also our centers. We also include their family members, especially the male members of the family, because we believe that they also play an important role in empowering a woman and helping her, realize her own value as well.
Just looking at few of our impact numbers here. So with just 5 women from the community, we've grown into a team of 65 people. And we have reached out to 1 million women over the last 5 years. This has also enabled us to create conversations about menstruation and reduce stigma around period, its knowledge and its awareness, which in turn has increased retention of women and girls in school and the workplace, and generated employment and improved overall standard of living. Just a brief landscape of our plans next year. With our ABCD of access, we aim to reach 2 million women over the next 5 years. And you can also help us through this journey by working with us, by volunteering with us, by being an ambassador, by promoting our work on social media pages and other ways to engage. Please reach out to us on our email. We can take a few questions.
So you guys could add into the chat, or you guys could unmute yourself and talk or question